Here we go. Go ahead and record it because I know there's a lot of great information that's shared here. So I want to make sure to share it with everyone else. And I think everyone, it looks like we always kind of do the general Zoom name check to make sure you're listed how you want to be listed and not listed how one of your kids or your spouse, the last time they logged onto the computer, might have been listed. We're going to use the chat function as we typically do, as well as, depending on the size of the group today, having folks turn on their mic, turn it on and off their mics if they have questions. For those that are new, I'm not sure if anyone here hasn't been on a call before, but this network brings together people interested in connecting around intergenerational shared sites. It's supported by a grant that Generations United has from the Eisner Foundation to really just build opportunities for people to connect, peer learning, sharing resources. We are planning and so far been meeting approximately every other month. We're thinking about ways that we can continue to expand and build and support the needs of everyone around here and what folks are interested in, ways staying connected if it's newsletters, or as I've started to do is when I sent out the reminder, I'm kind of keeping a running list of resources and links to resources, including our directory of members. If there's changes that you want to make, just send it to me. I'm happy to update that. These recordings, where the links are to these recordings, other types of events that Generations United and our partners and you are hosting that we want to share information on, as well as this ongoing promotion of our shared site toolkit that we are in heavy promotion mode for that. Before we get started, I just had a couple other announcements I wanted to make sure folks knew. One is that Generations United is hiring currently for 5 or 6 staff people. The positions closed today, but hopefully if you've seen it, if you know people who might be interested, we're really interested in getting out the word far and wide. It's an exciting opportunity. Largely because of GU has been awarded the National Technical Assistance Center on Grand Families and Kinship Families. So this is a federal grant that's we're starting to implement, or a federal cooperative agreement that we're implementing now and trying to staff up for. So, and then we did want to just quickly, I know Nancy had asked to say, we've been in conversations with NAEYC, which is the National Association for the Education of Young Children, and we're just curious if anyone in this group had any affiliation with NAEYC. If you want to just raise your hand. Oh, Carla, great. Because it helps us sort of think about who's already affiliated there and how we might be able to work along.
We may get in touch with you, Carla.
Yeah, great. And with that, I'll turn it over to Nancy.
Okay, well, welcome everybody. I think these conversations have been really helpful in the past. It's really interesting to hear from different parts of the world and different parts of the country about what's happening in the shared site world. And when Sherry sent out, I think it was a survey early on, what people were interested in. First was, of course, how you deal with COVID, and we focused on that last time. But something that came up a lot was the whole issue of staffing, hiring, retaining, training staff. And so we thought we would discuss the broad issue of staffing. And we have 2 people who are going to be sharing information today, and I'll introduce them in a minute. But then we want to really discuss what are some of the challenges you have and what are some of your hopes for learning today. So we're going to start by just doing intros. And I think people are just going to come in as we're doing intros. So we'll just keep going. So I'm Nancy. Sherry, just introduce yourself. I'm Nancy Henkin. I'm a senior fellow at Generations United, and I'm former executive director of the Intergenerational Center at Temple University. So if you could say your name, where you're from, and something you're really interested in learning today. Either a big challenge you've had or a topic area within staffing and staff training. And then hopefully Shannon will be listening, and Suzanne will come on, and we'll, in our discussion, try to address as many of those issues as possible. So I don't know how this goes. Maybe I'll just call out names as I go across. Okay, Danica.
Buddy, I'm Janika Jarrott. I'm Special Projects Coordinator at Generations United. I work with Sherry and Nancy and Emily. Yep, I'm just here to support the meeting, and I'm interested to see where the discussion goes.
Okay, thanks, Janika. And Shannon?
Hi, I'm Shannon Jarrott. I'm a professor in social work and am a part of this network. And a lot of you are going to hear experiences maybe you've shared with me in this story that I have to share today around staffing and training and measuring. Thanks.
Carla. Okay, great, Shannon.
Carla Moore, United Methodist Community House in the Grand Rapids area of Michigan. And what I'm hoping to gain is some direction on getting some cross-generational training. So we've had a very nice environment and culture, but over the pandemic, our staffing has changed and we have some staffing struggles. And then how do we regain and capture that base of understanding about the two generations working together?
Great, I think that's really important. And I'm sure Shannon is going to address some of that, right? Judith from London.
Hello, nice to see everybody. So I'm from Apples and Honey Nightingale, and I'm very interested to hear more about training because I'm in the process of writing a training course that I'm hoping to get accredited for an intergenerational certificate in care and education. And one of the issues that I feel is a problem can be the fact that in theory, you're working together if you're on a co-located site, but in reality, the care staff are employed by the care home and the early years staff are employed by the early years home, and actually how to work cohesively for the same vision when you actually are answerable to different people.
Yeah, and I think Suzanne Lair, who's at Jenks in Jenks, Oklahoma, is going to talk a lot about that too, the two separate organizations and how staff plan together and work together. Thanks, Judith.
Brilliant, thank you.
Jody. Jody.
Hi, I'm Jody Schumann, and I'm the Director of Childcare on the Ebenezer Ridges Intergenerational Shared Site Campus in Burnsville, Minnesota. And I'm also, I helped open 3 of our other programs, shared site campuses. So today I'm in the Minneapolis campus, helping out here while the director's on a leave. And yeah, I just, the training is just so important because figuring out the senior side and then the childcare side, but making sure that there's people that train on both sides. So that's something we really learned through the years.
Great, thanks, Jody. And hopefully you'll all be able to share in the discussion afterwards because all of you have done some of this. So I think Shannon's going to set the stage and then we'll open it up for discussion. And Mariano.
Hi, everyone. My feet are touching ground in Spain. I'm an associate professor in sociology at the university and the head of the Microsat Chair in Intergenerational Studies. I would really like to know whether any of you know any shared site that actually has developed job descriptions for each staff, including an intergenerational component, because this is the type of one of the things that we are now doing, implementing in the place I live. So we're going one by one, and we're having interviews with each staff member. We have produced one sample. It's been approved by the organization, and now we're going to go, and the goal being to have the whole list of job descriptions with this component. And I don't know any similar already made kind of document. Thank you.
And I know Suzanne's going to talk about the job description, have a sample of a job description at Jenks. I think of the intergenerational liaison, but I think you're going beyond that and saying that anyone who works in Microsod needs to have the intergenerational component included.
Anyone working at the shared site.
Right.
Anyone.
And I think that's really important and probably doesn't happen. It's probably clear about the liaison, but not necessarily all the other people. So, you can definitely get some discussion going around that. Sue.
Sorry, good evening, everyone. I'm not sure what time it is for you, but it's early evening for us. I'm from Liverpool in the UK, and I'm the founder of Ready Generations charity, and we're opening a shared site early next year. We just literally, to respond to Mariano, we've just employed an intergenerational lead practitioner last week, and that was very interesting, that whole process to see who came forward for that kind of role. So I'm particularly interested in hearing more about Judith's work in terms of getting accreditation, but also looking at intergenerational standards that could be applied to all staff, and looking at agreed kind of shared impact measures so that we can evidence our practice more effectively.
Great. I know that Shannon's going to address some of those issues, and we will probably have a separate session on evaluation, because that's a lot to take in, but I'm sure Shannon will mention some of that.
Great. Thank you.
Thank you. Thank you, Sue. Carolyn. You're mute.
Yeah.
Okay, we hear you now.
Got it. Okay, hi, I'm Carolyn Amler, and I am the Life Enrichment Director at Tower Light on Woodville in Minnesota, the USA, also a part of the Ebenezer. And I have Charlie Nielsen with us, one of my life enrichment assistants.
Hi, Charlie.
And I guess what I'm hoping to gain, I taught third grade for 21 years, and I've been an activity director, life enrichment director for seniors for 10. So I'm new to this building, but not new to the concept. I transferred here in January. And with the pandemic and everything, we haven't been able to do a whole lot. We did for a while, then we couldn't, and then we did for a while and we couldn't, that type of thing. So we're kind of looking, this is my first meeting with the group here, to hear what it is like officially Intergen is. Of course, not that we're official, but just what is the business side of it, and then hear how we can combine our kiddos across the way there with what we have here, being kind of new to that concept, putting my two worlds together, and then bringing on my assistant, who this is kind of a new thing as well.
Great. Well, welcome to the network.
Thank you.
Marie.
Hi, I'm Marie Hoover, and I'm the director of the Intergenerational Learning Center at Providence Mount St. Vincent in West Seattle. I think what's most interesting to me, because this is my first time on this meeting too, is just to hear how the challenges and the strengths that we have are kind of across the world. I didn't realize we'd have some people from from Europe, so that's exciting. So I'm really curious, particularly about training and hiring, and how other people are going about that as well. Thank you.
Great, thank you. And Marie and Jody were very helpful in designing the shared site toolkit that I highly recommend those of you who are new go to. It's sharingourspace.org. Because there's a lot of information in there on not only staffing, but other things. If you're getting started, it may be helpful. Is that Nika?
Hi, I'm Nika Barnes. I work with Andrew Fleck Children's Services. I'm the Director of Special Projects, and we're located in Ottawa, Canada. So that's in Ontario.
Great.
And yes, and I attended the last meeting and have been looking forward to this one ever since. This is an amazing group. This is the networking that all the possibilities are really inspiring. And already, even through the introductions, I've got, I'm just writing down a bunch of questions. But similar to Sue, we just hired we're doing a new build here in Ottawa. It's going to be an intergenerational program, and we've just hired staff for that. And so we did get through those, the interview questions and what sort of things to ask and that type of thing. So I'm really interested in further looking into that to see how we can improve ours. and also just bringing a whole new, like onboarding a whole new team to this wonderful concept. So thank you.
Great, and we welcome Canada.
Thank you.
Next. Okay, now let's see. See everything messed up now. Now Marie's already gone, Carla's already gone, Emily.
Hey everybody, this is Emily Patrick. I'm gonna spare you my video today. I'm home with a couple of sick kids. So I work with Generations United, mostly on intergenerational program work alongside Sherry, Danica, Nancy, and just so excited to be bringing this group together. I want to thank Chelsea and the Eisner Foundation's support for making this possible, but just excited to listen to the conversation and learn from you all today.
Thanks, Emily. Chelsea from Eisner.
Good morning, everyone. I am also sparing you my video. It's been a bit of a morning, but I'm Chelsea. I'm with the Eisner Foundation. We're thrilled to be a part of this fantastic work that Generations United has are vital participants of. So today I'm just sitting back and listening to all of your wonderful insights. Thank you.
Thanks, Chelsea. Ness. Oh, what happened to that? There you are.
There we go. Sorry about that. I'm also going to turn my video off so I can eat my lunch during this call. But
you know, you can eat it. It's okay. We'll just be jealous and see what you're eating.
So I'm also from Canada, Toronto, Canada, and I'm with the Waltons Trust. And Waltons is a relatively new grant-making foundation that does work both in Canada and in the UK. We are focused on the environment, early childhood education, and seniors. So co-located sites are of particular interest to us here at Waltons. And we have a few small grants that we have made thus far in the space, but I'm really excited to learn more about what's happening and connect with all of you. So thank you.
Great, thank you. We love having both practitioners and funders on this. So I think it's really great that you've joined us. Great. Let's see, Austin.
Hello, I'm Austin. I'm a Grand Valley University social work student. I am interested in like intergenerational macro level work, and I'm also Carla Moore's intern. So he'll be.
Oh, so okay, Carla, that's good. Bring on the interns. That's good. Well, welcome, and I'm sure you're having a great experience with Carla. They just do amazing work. So welcome, Austin. Okay, Netta. Hi. What happened to Netta? There you are.
Hello. Hi, I'm Neda Norouzi. I'm a professor in architecture at University of Texas at San Antonio. My focus is designing intergenerational centers. So I love coming to these sessions and learn about everything that I don't know about intergenerational programs, and then explore how we can incorporate them into designing new intergenerational centers.
Great, thank you. And Netta also was very helpful in designing our sharing our site, sharing our space toolkit. Good to see you, Netta. And let's see, Lisa.
Hi, y'all. Sorry, I'm a little bit late. I actually had some surgery on my face this morning, so I am also not sharing my. I live in Denver, Colorado, and this bright sunshine is not great for the skin. So, anyway, I am the owner of well, not owner, but I work for a nonprofit, my own nonprofit, Montessori Intergenerational Learning Communities, with the idea of opening a shared site using Montessori principles for the early childhood side and Montessori for aging and dementia for the elder side. Since COVID hit, I did a little bit of a spin-off. In early childhood, we're having a severe workforce crisis. So the last 18 months, I've been working on a program to train healthy older adults in early childhood and get them out into the workforce as subs, which is much needed in Colorado. So those are the two intergenerational things that I'm working on. And I love to be with this group because I always learn so much from all of you. So thanks for having me.
Great. So I think that's it. It's a small group today, but the nice thing about having a small group is there's lots of time for discussion and sharing, you know, the challenges and successes you've had. So I think we're going to go right to Shannon, who Most of you either know her work, know her. She's, as she said, she's at Ohio State University as a professor in social work, and Shannon has been a really, really important person in the shared site world, has written a lot, has done a lot of research, and we're so glad, Shannon, that you took time out from your busy schedule to share some of your thoughts with us. So take it away.
All right. And like I said, I've got people on this call who've helped to contribute to this story, and I'm grateful to all who've been a part of my journey as well. I'm glad if I can do the same. I was working from some slides from the GU conference this summer. It was exactly 5 months ago today that I shared with the Generations United audience. If you were there, some of this will still be new. So with regards to staff training, let's see, it was Lisa who was talking about Montessori programming. I was really excited in my first intergenerational site to do some work with intergenerational Montessori-based programming. And I had spent all my time in graduate school studying these two populations. I can see I don't have the slideshow on, so my animation effect is lost. The young children and the older adults, and I'll tell you a little bit more about where this is in a minute. And we did all this planning. The graduate students got trained. We learned about the Montessori-based principles for programming for adults with dementia. We worked with our partners at the Child Development Center for Learning and Research. And then we got together and I realized that it was this person in the background that I needed to be concerned about. The teacher coming in from the lab school or the Child Development Center, standing with her back up against the wall about as far as she could physically get from the older adults. And it's like, oh, well, of course. These staff who we're asking to bring young people and older adults together are not employed to do intergenerational programming, to Mariano's point. They were employed or chose to come and work with one population because that's where they had their training. That's experience they had. That was the preference that they had. And so that really quickly pivoted an expansion of my lens on who I needed to be attending to if I was hoping to achieve positive intergenerational contact with any group of young or older people. I was really fortunate to be able to work at Virginia Tech for 16 years before I came here to Ohio State. And I was the director of research for an really unusual in-department, on-campus adult day services. And that adult day services is located right next to a child development center. At the time, it was called the lab school. And so I had a bunch of nerdy people like myself who wanted to talk about theory and human development and how we could use what we knew about child and adult development to effectively bring young and old people together. And we also thought about what did our staff and dozens of students every year, new students every semester who are coming through the center, what did they need to learn if we were going to hope for positive outcome? And so we developed a training model that we repeated a lot of in-person time. Again, because of this university setting, we had directors and faculty who were willing to give us big chunks of time when the center was closed to dedicate to staff training. And we had a lot of success. We also worked with students. I do have this hyperlink, but it's not going to work because I'm not in a slideshow mode. We created a long time ago with student input, a document you can still find at the Generations United website, the tried and true guide to intergenerational activities at shared site programs. It does not detail our specific program orientation or philosophy, but it does reflect a person-centered curriculum, an emergent curriculum, and it includes things that can be useful for new practitioners. For example, students and staff who are new to intergenerational programming are often not sure how to facilitate conversation if you have got a quiet group with you. And so those are some of the things that we included there. With the development of that model in a lab setting, well, as a researcher, you want to go out and see, does this model work in the real world? And so that's what I went about doing next. And I will take a minute to talk about this funding, both because it's important to acknowledge your funders, but also because it could be a resource to you. The USDA CIFAR stands for Children, Youth, and Families at Risk. This is a programming grant. They are awarded within every state. They are awarded for a period of 5 years. They are not very interested in old people as your research or your programming subjects, but they're interested in families and children and youth. And I have effectively made the case to them 3 times now that I need to involve older adults in this programming that's responding to the needs and the strengths among families with young people in them. And so Project TRIP, TRIP stands for Transforming Relationships Through Intergenerational Programs. Neda on this call actually designed this logo for us. We took our training model out into 4, Nancy came and visited one of these sites too. Took them out to 4 childcare centers in the state of Virginia. And we found out that, gosh darn it, our plans to provide training on a Saturday for 5 hours were not very well received. We also found out that the staff were not really inclined, like our highly compliant, brainy university students, to fill out 3- and 4-page long evaluation forms after every single activity that had a lot of open-ended questions. And so while we felt that our model was good and the people we were working with felt strongly and positively about what they were learning to do from us, we had to streamline it. It just wasn't going to be sustainable. And so we created a best practices checklist, which I'll talk at more length about in a little bit. And this was intended to measure how well were the staff engaging and exercising in the skills that we were teaching them to do during our orientation. I'm gonna probably have to do a new share here. I'm really excited to share this. Oh my gosh, too many buttons. I'm gonna get it. I'm gonna have to move a bunch of things around on my screen. My background is from the Gerontological Society's annual convention last week that was going to be in Phoenix and was not. And I found after 20 months, people with PhDs still don't know how to share their screens on Zoom. Some of the time I was that person, as is the case in point here. This paper has just come out. You can access it even if you aren't part of a university. Program practices predict intergenerational interaction among both children and older adults. We found using our best practices checklist that when staff utilized more of the practices we had taught them to use, there were higher levels of intergenerational interaction, both for the young people and for the older adults. And contrary to our hypothesis, it didn't matter whether this was the child's first intergenerational interaction or their 10th or their 15th. We thought maybe levels of interaction would vary as a child or an older person had more experience with us. It turned out that when the staff were using these practices, the kids and the older people could feel confident and comfortable just fine on that first activity. So I'm really proud of that. Now I'm going to
How do we access it? Shannon, can you?
I'm gonna paste the link into the chat.
Great.
After I finish this presentation, because I can clearly not
Great.
do more than 2 things at once.
Great.
So we were really excited with that. We got this down to a 2-page document that staff answered yes, no items. So of course there are limitations from a research perspective, but it was much more user-friendly, and very closely tied to the training that we were delivering. We also created self-paced best practices training. And oh shoot, I'm gonna have to navigate away from here again to show you that. This was what we shared in June at the Generations United conference. This is now available through OSU. Some of you may have heard about it or learned about it being offered with extension online, but we've updated it to reflect the data analyses that we've been doing. It is now available as a 2-credit continuing education, a fully asynchronous course. Because you know what this is like. We had staff who told us that they were told to do this training during their lunch break. They were told to do this training while the children were sleeping and they were supposed to be documenting. They were supposed to be doing this training at home on their own. They didn't have iPads, or they didn't have computers, or they didn't have good Wi-Fi. We've tried to move towards encouraging administrators. We've got administrators on this call to pay your staff to do this on the clock, wherever it is that they're doing it. And so we've also trimmed it down. This used to be a dozen modules. We've now got it down to 3. And I'll show you what that looks like in just a second. That is not the right thing. Nobody wants to see my email. Okay. And here is this. So you may be able to see this website, but I can share that with you as well. It is scarlettinstructure.com. And so we cover a couple of different things. Certainly, we all borrow from each other. I heard Judith talking about joining this to inform the course that she's developing. Nancy's work is rife through my materials, and Netta's and my materials are represented in sharing our spaces too. So we provide some background in this module on why you might be interested in an intergenerational program, how to make the case to your administrators. We talk about the best practices that we've trained on, and we try and provide some reflection opportunities and links to a lot of other resources as well. And we have paid in advance for some free registrations, and I imagine that you can get in touch with me and I can put you in touch with somebody who can help you with accessing this at no cost. So let me go back to my slides. Oh, except that they're not there because they're hiding here. All right. Also, and I'm glad to acknowledge another funder who worked with Generations United and with me to support a survey that we did back in 2018. Some of you on this call completed that survey, so thank you for that. And it was a survey of all kinds of intergenerational providers. The data here are based on shared site providers. And we asked about challenges that we had understood from experience and from the literature providers often had. These are just the top 5 that people were experiencing. And I'm pleased to show that there's been some movement forward, and I've been able to play a role in that as well over the last year with regards to the number 5 challenge of locating training resources, the continuing ed class that I just shared with you, staffing and funding. I've shared a little bit on funding, and there will be more conversation today about staffing. Peers, thank you to GU for creating this shared site network and having all the other ways that people can find peers in their area. And the last point I'll talk about before wrapping up is the evaluation toolkit. And I am gonna change that sharing again. We heard from folks a lot that they weren't sure. They knew in their hearts, they knew from the words that their family members shared with them. They knew from the looks on the faces of the older adults and the young people that they worked with that their programming was making a difference. They also knew that they were responsible for articulating this in grant proposals to secure funding and in reporting back to funders that they had done their due diligence and met their obligations. And so I worked for quite a while through a lot of literature to compile a collection of measures that have been used in intergenerational research in the last decade or so. I only selected those measures that had demonstrated reliability and validity indicators. And I also selected those that I thought would be most user-friendly to a mix of practitioners and also some researchers. And so I would like to navigate to that. This is available through the Generations United website. I'm grateful that they've been quite generous in sharing information about and promoting this toolkit. And so we've got over 20 different scales. Here's an example. Some of you are interested in intergenerational programming because it promotes empathy among the young persons. I'm sorry, I'm moving so fast, but I'm gonna stop right now. And so for each of the measures that's in this toolkit, we have a little bit of information about who is the youth or older adult population that would be appropriate to fill this out. 7 to 11-year-olds can't fill out the same things that your 14 to 18-year-olds can fill out, for example. There's information here about exactly what's being measured. You don't want to pick up a scale just because it's short and it's for the right age group if that's not part of if it doesn't reflect a construct or a goal you're hoping to achieve. It has some information on how do you administer the scale. Sometimes you want to make sure you've got somebody with at least a little bit of health or social science background behind their training to administer this scale. And sometimes there are directions on how to score these items and then also how to interpret the scores. You want to get that information. Here as well, you'll see under psychometrics, I've got the information about the author's report on reliability and validity of the measure. This gives you as a practitioner more credibility when you are reporting on these outcomes to your funders or your interested stakeholders. There is also a citation of where it was used intergenerationally and elsewhere if it was not first used in the intergenerational setting. A lot of these scales I actually created for myself. The authors of the scales would not allow me to do that. And so there's information on how you can access it at another location. This document does also include the latest version of the best practices checklist. And that was created with input going all the way back to my time at Virginia Tech, continuing forward with our data from Project TRIP, and then through a Delphi panel that I conducted, including with members who were here on this call. And I'm trying to scan to that and I don't scan and talk. I'm sorry, I'll find that and share it later. But it is a couple of pages. It is intended for individuals at shared sites, but not just shared sites, to be able to document how well staff are using their best practices. The idea being that they may find that the more best practices they use, the more positive outcomes they note. They may find that some groups of young people or older adults are harder to achieve some of the best practices with. They might find that some of their staff have got questions about what some of these best practices actually look like. So there is a user-friendly version that you can download from the Generations United website. We have a sample of a completed checklist in here as well. And there's guidance that your staff could read on how to complete those. This completely overlaps with the best practices that are covered in our continuing education course as well. I am probably about to run out of time, but I do want to share one other thing about myself and what I'm up to, and it'll give you a chance to offer me input and feedback as well. I am serving as a health and aging policy fellow this year, non-residential. It's a part-time role. And what motivated me to apply for this position is reauthorization of the Older Americans Act and questions that shared site practitioners ask me and a lot of my colleagues all the time. Things like, why is it so hard to operate this program? And how do I fund this program? The reauthorization of the Older Americans Act in 2021 included new language about intergenerational service delivery. I said, that's what I want to figure out. I want to find out how this money is getting distributed to the groups that tend to get OAA money. And I want to make sure, if I can, that the agencies receiving these funds have got evidence-based practices to help ensure that they're delivering their intergenerational services in an effective manner. We are just in a heavy-duty, intense training process about how Congress does and doesn't work. And I will be doing interviews with maybe congressional representatives and their staff and surrounding agencies to have a fellowship that I work on a project through the next 8, 9, 10 months. So I've been looking around to figure out who I should talk to. I've got a call with folks at GU tomorrow to ask for some introductions, and people on this call might have an idea as well. But I'm grateful for the work that you're doing in the shared site arena, and we're going to take it all the way to Capitol Hill. GU's already there, so that helps to lay the path for me. And I'm glad to answer questions, and I'll work eventually on getting those links into the chat box.
Great. You want to stop screen share and then we can get back to everybody. Thank you so much, Shannon. We are so grateful to you for all the work you've been doing for so many years. And I go way back with Shannon when she was a graduate student. So I've seen, and just your contribution is amazing. And actually, I don't know if it's changed, but I drew a lot of the information in Sharing Our Space toolkit around training from her best practices. So you can actually link to, hopefully we can still do this, Shannon, link to the actual best practices that are in there. We might want to look at that to see if it's still, if it has to change to OSU or not. But we have time to have lots of questions. I'm sure many of you have questions. So can we get back to seeing everybody, Sherry?
I think we can. You just need to change your view back to gallery.
I need to do that. I need to do gallery. Okay, now we can. Okay, so maybe just raise your hand if you have a question or a comment, or want to, have Shannon clarify something. So someone have anyone with a question or a comment? Judith.
I just want to say thank you very much. It's really interesting. It's great to see that so much groundwork has been done. That it's not that everyone's coming in new, but there's a lot there that we can share and learn from. And it's fantastic to actually be part of a group of people that actually want to share, that it's not a competition, that we all actually have the same aims and ambitions. So I just wanted to say thank you very much. It's really interesting, and I can't wait to get reading.
Great, thank you.
And we'll thank you in advance for the new resources that you're going to create and share. Yeah.
Yeah, everything just complements everything else. It's hardly a competition because we have so little out there. So all these tools and manuals and best practice lists are just so helpful to people who are already doing the work, as well as those who are just beginning. Other questions or comments? We have a lot of squares there without pictures, so I don't know whether you're raising your hand or not.
Oh my goodness. I have been in so many Zoom meetings over the last couple of weeks, and they get to this point and they ask for questions. And I think people are just like zoomed out. So I'm very happy to have questions, or I'll ask you a question, which is, what agency should I be talking to in Washington, D.C. to explore a potential fellowship? That's secondary, though, if you should want to discuss things about what I was just sharing.
So I'll jump in. I think that this presentation was extremely helpful. I don't have a lot of questions right now because I've just been provided some really great tools that I need to spend some time with. Right. So that's kind of the reason for my silence right now, but wow, I'm excited for all of this. So that's my input.
No, it's great. And I think what you've done, Shannon, is really terrific. What are some of the challenges that some of you are facing? I mean, Shannon dealt with a lot in terms of training, and Suzanne, when she comes on, we'll talk a little more about how staff plans together. But what are some of the challenges you face with staffing right now?
For me, it's Nika. I think that it was the first, Shannon, the first photo that you showed of the educator in the background. I think that that's one of the things that it's been weighing on me in terms of how do we engage, and how, like, and though you put it quite nicely, the way you said is that they've been trained to work with children. Now, you would hope that anybody who has a shared site program would be taking into account the interest of the educators and their willingness and their desires to work with older adults. But and then you talked about sort of the I was writing some notes and thinking, like, do we need to have a pre-participation checklist or something, you know, just to be able to show and demonstrate that the program has made a difference to the people who are involved in the program. But so I guess that's sort of like a two-parter. But so first of all, though, how did you work through that piece around the educator being in the background?
Thank you. And I know that the new GU resource, as well as the things that I have released this year, have both offer some guidance on preparing staff for bringing the two age groups together. And I think it's a little bit different if you are introducing intergenerational at programs that already exist and they're steeped in their mission and their name and their philosophy. And again, I had the real advantage of being at a university where we spent time coming together and talking about, you know, what were our understanding of theory and about the needs and the strengths and the frequent misperceptions that people have both about children and about older adults, to see where there were things that were in common, where there were things that were different. We then worked quite intentionally for a while on developing an intergenerational mission statement. We tried to be very clear that it wasn't going to supersede the Child Care Center's mission or the Adult Day mission, but that it reflected values that we then had leadership communicate to the students and the staff and the administration. We really worked on creating a shared identity around that. There were efforts, back to Mariano's point, I really want somebody to solve his situation, of thinking about how do we work the language about expectations into the different job descriptions, when we had some staff who were willing to take that on and some who were adamant. I was hired to work with old people. You can't make me work with little kids. I don't want to. But and anticipating that there will be some challenges. Now, we had conversations where we didn't almost come to blows because we were a bunch of human developmentalists, but where there were fighting words that came out. And you dig a little bit deeper and you find out you're talking about the exact same thing, you're just using different words for it. And so anticipating that this is an issue, you're a step ahead of the game already. You can start anticipating it. I may have only started to answer part of your question.
No, I think that's just fine. And I'm happy that we already have practices and principles for and it's part of our licensing reviews as well. But that what we did is we looked at, we had a student from one of our Bachelor of Education programs locally, and we did work really diligently at how do we integrate, how do we bring marry the two together, how do we make sure that seniors just aren't participants there for the children. We want them to be part of the community and the heart of that community. And so we've embedded in our practices, just ways to be able to make sure that older adults are part of the system. They're just not just a user.
Yeah.
Right.
And I have used, adapted from my early days at Virginia Tech, a worksheet and a short outline of what you might do when you're first bringing those staff together, or when you're doing onboarding with new staff, to get them talking about what do they think the differences are, what do they think the obstacles are. And so that would allow you or one of your other supervisors to acknowledge that maybe people have got some stereotypes that we've all been exposed to, and then to work at remedying those.
We have some other calls. Lisa, we have some hands up now, I see. Okay, Lisa, and then Mariano.
Yeah, I just wanted to not to always be beating the Montessori drum, but I'm a Montessorian, so I can't help but beat it. But one of the things that I'm finding as I'm doing this work is that because both the folks that are working with elders and the folks that are working with children, we're all under the Montessori philosophy. So we have like we have an overarching umbrella, sort of a philosophy of life. For those of us that believe in Montessori, we really live our lives that way. And I found it to be much easier to, you still have people that their love language is with the older folks, and you still have people that their love language is with the children, but because they're all doing it under shared pedagogy, is the best way that I can think of to say it. It seems to be a little bit easier to make it make sense for them. That was, and I had another thought, and I don't remember what it is. It must be the Novocaine in my face at the moment.
You're doing really well for just coming back. I guess it was the dentist or some of your face, whatever it was. No, I think you're right, Lisa, and I think having that overall philosophy, and Shannon also talked about having an intergenerational mission, having a common vision of what this is and having people buy into it is really important. Mariano, you had your hand up.
Yeah, thank you very much, Shannon, and this is very interesting. I would suggest that we probably may schedule longer meetings once a month, and 1 hour seems to me very, very short. I want to share because of what Shannon said and the amazing work she does. I want to share one little idea. We've been working on training. I'm responsible for the planning of activities and the program planning in a shared site. It is only 3 years old, and we've been doing training in many ways. And we're now trying to approach the training as a component within the programming. So instead of looking into these two areas as complementary yet separate, we are working on them together and using. We haven't been able to use or find a simple strategy. We have to combine different strategies. I can now explain on those, but we use a variety of different ways for this training to happen. But the point is this: we are not focusing on activities, but a joint programming with a joint rationale. And within the rationale, we have introduced the question, what about the training that you're going to need? And so
Hi, I love you. Sorry, I forgot this was on.
Let's step back a minute, Mariano, and just repeat what you just said.
I was saying that instead of let's say now you tell the staff, now you want to work on the training, and then you do activities or whatever it is regarding program. No, we are working towards a joint approach in which training and the programming is kind of merged, and you do both, and it needs to be, in our case, fully horizontal. We are doing our best to have people, staff people, doing the training very informally on a daily basis. And to give you one example, we've been successful to have one intergenerational coordinator to do a kind of final work for a degree, and she accepted to focus on the intergenerational work at the center. And I can't tell you how many outputs how many progress we've reached, because this one staff, because she had spent a lot of time doing this study with our support, and she became the actual trainer for the rest of the colleagues, it changed the whole thing. I mean, it was an insider working from within, and it changed everything. So that's to contribute. Thank you very much.
Thank you, Mariano. And we look forward to seeing some of the work and hearing some of the successes and some of the challenges as you work through this and really have an integrated approach to building capacity. You know, that's what we're really doing, building the capacity of staff to do good work. And it's not just activities, it's also a philosophy of how they work with young and old. We're going to move on. Thank you again, Shannon, and thank you all for your contributions. Before we move to Suzanne, I see she's joined us. I see three people who didn't introduce themselves. If you could just introduce your name and tell us your name and where you're from. Karen Krause. Are you there? Maybe they're not there. How about Maria? Or Sandra?
I'm Sandra McGuire. I am a retired professor emeritus at the University of Tennessee, Knoxville. I coordinated, which don't exist anymore as far as I know, the gerontology program there. And right now I'm doing things with Age Friendly Louisville, and we're very interested in what you're doing with shared sites. And we're doing some intergenerational activities, but we are interested in what you're doing with shared sites.
Great. Well, welcome to the network, Sandra. Okay, Suzanne. I know Suzanne had a conflict. She had to run to another meeting, so I want to introduce her, and she's going to share some information with us. So Suzanne now, right, is Assistant Superintendent of the Jenks Public Schools in Oklahoma. But up until, what was that, a couple of months ago, she was principal of Jenks Elementary School, I think. Is that right? And yet, okay, you can clarify this, Suzanne. Yes. And Jenks and Grace Living have had a really wonderful shared site for many years. And Suzanne has had just a ton of experience and has some really great insights into staffing issues, both the hiring and the preparing, how staff work together to plan. So I'm delighted that you're able to join us, Suzanne.
Well, I'm happy to join today. I'm going to do my best to share my screen. Is the audio okay? Are you hearing me?
Yeah.
Well, okay. Good. Wonderful. Okay. Give me just a moment to share screen. This is okay. Not.
I know Sherry's a good backup there, Sherry, right?
Yeah, I did make you a co-host, so you should have.
Okay, so I'm realizing I need to open preferences. I apologize. My goodness, this may be confusing. Do you either of you, would you want me to share your slides? Would you please? That would be great.
Yeah, that's why we always have backups. This is
well, and I'm glad we had the backup today.
It happened to me many times. So.
Okay. Well, I will first just start by saying, I'll wait till I can see the slides. I'll start by saying I wish I could have been part of the conversation starting out in the meeting. I had another commitment and hated to miss the opening discussion. And hopefully, hopefully I won't repeat too much that's already been discussed, but please, as we go along today, please feel very comfortable asking questions. And, I just want to be as open as I possibly can. Yes, I've been part of GRACE, the program in Jenks for the past 22 years. Our program has been in existence, for a while now. It's pretty established. But I will say, we in recent years have faced many of the same workforce challenges that others are facing across the nation. And so, that really, I would say the first probably 10 years of the program, it went really, really smoothly because we just had very few staffing changes. And then here recently, I would say the past, even before the pandemic, probably the past 6 to 7 years, we've had some staffing changes that have really presented unique challenges. So But having said that, I want to share just a few of the things that we've learned along the way that have been helpful. We're still a work in progress, very much. Again, please just feel free to interact and ask questions as we go along. You can go ahead and skip to the next slide, please. Just a little bit about GRACE. It is an Eden Alternative Philosophy of Care Center. And so that's definitely the thinking, the philosophy. There are animals. It's just a really wonderful environment for, for our students and for the grands. The whole goal and the whole premise that GRACE really stands upon is just lessening that loneliness, helplessness, and boredom with the residents that live in the facility. One of our biggest objectives is certainly to just, connect children to the grands who may be absent in their lives. We have a lot of kiddos that don't have grandparents immediately available in our community. And so it's just a wonderful way to bring the two together. And then certainly supporting our students as they experience the circle of life. And that's a big teachable moment for us as we think about our work in the intergenerational programming. Okay, please go ahead. So a little bit about positions and staffing. We have several positions that Jenks Public Schools, as a public school, we provide in the partnership, and that is a pre-K teacher, a kindergarten teacher, and 2 early childhood assistants who are housed in the skilled nursing facility, made up of 2 classrooms, and they have a really wonderful playground and a really nice common space that they share with the GRACE residents. So GRACE provides, and this is an investment on their part, but they provide a position that is a school liaison director. And I will say that is one of the most critical parts of making this program a success. That for us would have been a deal breaker and would be a deal breaker. And we have had to, over the years, just really work to make sure that there's a shared understanding for the need. Make sure that we have really good communication about what those expectations are. And I want to go into the next slide and share with you just a little bit about that. And I'm happy to provide, and I just cut and pasted the job description because I think it's important, and I'm happy to share this with anyone else who might be interested. We can certainly share the link. There's nothing that you might be able to benefit from. Hopefully, just having an example. But as you kind of go through and you look and you see what those expectations are, you'll notice that the liaison just plays that really critical role in identifying the residents that would be most able to work with the students, and really looks for tapping into their interests. I think about the liaison as a master teacher who is differentiating and identifying those needs of the residents, the grands we call them mostly, but really identifying what their needs are and the areas in which they can interact with the students in ways that would be supportive to them. And so there are different entry points. Not all residents come with the same, cognitive abilities, with the same readiness abilities, with the same ability to interact as others. And so it's very much that person's responsibility to help identify the fits. So whether, and we'll go into a little bit later about some of the ways that our residents interact throughout the day in a normal year with our students. But again, I think that liaison position is just being critical to be able to really identify what those needs are and really connecting those residents who have that desire to work with the students, just connecting them in the right place at the right time with the students. There's a safety component also that is very important to that position, and that is that our classroom teachers are never responsible solely for the safety of the residents when they're in the classroom interacting with the students. So that's why the liaison is there to just ensure that all of their needs are met as well. The classroom teachers are very much charged with making sure that the students are always safe and always, doing what they need to be doing. And so there's always that liaison there to, to support the grands or the residents when they're visiting the classroom, or if we're in a shared activity together. You can go ahead and move on. This is the page 2 of the job description. And this really, and I won't go into depth with this, but this just gives you an idea of, those times when the school is not in session, the way that the that Grace can utilize that position, and they do. I mean, that person stays busy all the time. And even when we are in session, they have duties that are very specific to the facility. And then duties that, outside of when we're not in school, there are, definitely responsibilities associated with the position. But I'm happy to share that later on if anyone would like to see that. You can continue, please. And so this is a different take on it. This is a list that we collaboratively worked with the teachers and the liaison and the Grace administrator to really, nail down what are those expectations for the Grace liaison. And we start the day, that person will confer, the liaison confers with the teachers just to kind of go over the schedule of the day and what are the experiences we're planning for. We've already planned, the experiences are planned, but they're going through and just kind of setting the tone for the day. Encouraging, the residents to come welcome the students. But that person again is going and gathering the residents and bringing them down to the atrium area so that when the students are arriving, they're ready to do the high fives and the encouragement that our students enjoy as they enter the facility. And then we go to Reading Buddies, and Reading Buddies is one of the really stationary activities that has been ongoing for all 22 years that we've had the program in place. But the liaison is not just showing up at the right time. The liaison is going and gathering the residents, helping prepare and developing the book choices for the residents and the students. So finding material that's appropriate on both ends. And we have like a little mini library that person is able to, she's able to pull books and put those packets together. Again, differentiating different choices. She's gathering the students then and bringing them down to visit and to work through reading buddy time. And they do that in our cafeteria. And then again, it's just monitoring, for that 30 minutes that our residents are with our students and they're exchanging and doing the shared reading. It's just monitoring and kind of making sure that everybody's needs are being met during that time. And so the liaison is very busy during that time. And that just, we've detailed and given you just a little bit more information. 10:15 to 10:45 every single day in a normal year. And I'll talk about that in a moment too, but in a normal year, we have exercise class. And again, that's just part of what the Grands do. They're gathering as a group in this big, wide open atrium area. And the students are just joining in on the exercise, the movement, and it's really fulfilling that great need that we have for our pre-K and kinders to have movement throughout the day, while also, just having them work alongside the Grands. You can go ahead and advance, please. So, and then every day, 10:45 to 11, we do a fun sing along with the Grands. And that's just another component we've added. The exercise and the sing along have not always been part of what we do on a weekly basis, but they're definitely really integral parts that we've added in the past couple of years, and they've been just very successful. 12:15 to 1:30, we do a shared study, and that's Mondays, Tuesdays, Thursdays, and Fridays of each week. Again, that liaison is just preparing supplies, making sure that all the resources are available, going and gathering the residents, and then helping to facilitate that experience with the students, and then supporting the cleanup, the finish up of the project that they're working on. And then we do an ice cream social each week, and this has been an ongoing activity that we've had for years. And again, there's some taking of orders ahead of time that the liaison does to prepare for that day. And then when the students come out of the classroom, it's really circulating with the small groups of students. And sometimes she's helping to facilitate those conversations, because especially initially as the Grands and the students are getting to know one another, there's a lot of modeling when you're working with young children that you do as an adult to help them feel comfortable engaging in conversations. But then that really just becomes such a natural part of their weekly experience as time goes on. And then the dramatic play, and this is one of the most fun, engaging activities that we do frequently with the students. Again, gathering those residents, bringing them into the classroom to engage in the dramatic play session or the situation that the students have come up with. we leave it to the students to identify what they want that play to be around based on the unit that we're working on. And they come up with ideas that we would have never dreamed of. They come up with the most unique ideas. But it's, the liaison is there to really help model the language. If they're in a, I can think of times when they've done a pet store activity, and it's really just, well, what would you like to buy for your dog? I see you have a little puppy dog. And, it's asking questions. It's bringing them into a play scenario. And it's really helping to bridge the grand with the younger student in a conversation. And they immediately jump into the scenario and play. And it's just a wonderful interaction. But there's really a lot of deliberate preparation, a lot of work that goes into the behind the scenes, if you will, the position of the liaison. And I hope I know it seems like we've probably captured a lot of details, but there are a lot of details associated with what that person is expected to do. Sometimes I know when we've had conversations with our collaboration with the administrator and with the activities director, and sometimes I think it's just assumed that that person just needs to show up in the classroom. And there's so much more involved in that person's role than just showing up or just gathering the residents to show up. I mean, there's more to it. And we've had years where we've had really incredible liaisons who just are really intuitive, and they just collaborate so naturally with the classroom teachers. And then we've had years where we've had to be super deliberate in explaining what that looks like. And so I think that's, when we talk about staffing, I think that's just a key. We have to be really careful and thoughtful, and don't take for granted that everybody knows what that needs to look like when you're working together. Okay, you can go ahead to the next slide, please. So that brings us to collaborative planning. And again, I'm spelling this out. I'm sure many of you do this kind of thing within your situation, but we deliberately plan a monthly collaboration meeting. It's usually about an hour long, and we're usually planning out about 5 or 6 weeks. In that collaboration group, we include our pre-K teacher, our kindergarten teacher. Actually, our executive director of teaching and learning attends that meeting from the district level. We have a teaching and learning specialist that's associated with the elementary site that attends. The site principal attends. The school liaison always is there. The GRACE administrator participates, and so does the activities director. And it's kind of a nice mix of people, but you get lots of different perspectives when you have that cross section of individuals. And we have found that it's super important to have the administrator there, because the administrator is the person that sets the tone for the building and really sets those expectations. And we want that person to be knowledgeable about the program, about the kinds of things that are happening in the program. And so just having that person there is just really key. We have found the activities director being part of those conversations is also integral. And just a kind of a funny little example would be, we realized there was an activity, and I forget which activity and the day it was, but there was an activity not many of the residents wanted to come and participate in, and we were surprised, and we were trying to figure out, kind of puzzled why they all of a sudden they're not wanting to come during that time. Well, there was an opportunity for kind of like a nail salon activity where fingernails could be painted that was in conflict with that activity in the classroom. And so we were, it's just one of those aha moments. Oh my goodness, we need to be on the same page here. We need to be coordinating our schedules so that we're not penalizing, the grands that want to participate in perhaps both activities. That's one little silly example, but you get the idea. I mean, it really has just been helpful for us to all be on the same page, working together as one unit. And then we're not working and competing against one another. So that's been important. You can go ahead and advance. So what is our goal with collaborative planning? We really pride ourselves in looking at our curriculum standards from a public school perspective. Our students that participate in the GRACE program absolutely have to adhere to the academic curriculum standards that all of the students in the rest of our district and our state have to work with. And so we have developed units of study, and we look at those academic standards and our units of study, And then we think about opportunities within that structure where we can bring the students and the grands together for shared learning. And so some examples, and I've already mentioned a few of those, but some of those examples are the dramatic play experiences. And, we really try to bring student choice into that, into play with that, and give students lots of agency to think about what they might want that dramatic play situation to look like. I think I was over last Friday, and currently they have a Thanksgiving kitchen set up. And basically they're preparing food and, and have that whole hustle and bustle that you might imagine that many of them probably experience in their homes around the time of Thanksgiving with, preparation of food. And so that was what the students chose. And that's what the grands then, interact with them in the dramatic play experience that we plan for. We do visiting field trips because the students are naturally so curious about where the grands live and want to know a little bit more. And it's a way for us to teach about, how to be respectful of their homes and their spaces. And it just, again, a lot of manners, etiquette that is just a really teachable moment for us. The reading buddies I've already talked about, but that's just a delightful time when sometimes the grands are reading to the students. Sometimes the student is reading to the grand. Sometimes it's a shared reading, kind of, I read a page, you read a page, or we help each other when there's a word we come to that we might not know what it is, and that sort of thing. But it's just a delightful bonding experience. It's just a wonderful time for the two to be tucked together with a book and just, enjoying reading together. Gardening together is something that we added in more recent years, and that's been a really fun experience. We've had some platform, they're like elevated beds, I guess, that our facilities management department actually constructed for the center, and we have them on the playground. And they've done some really creative things with the gardening, and that's really something hands-on that it's been great for both populations to be part of. They've actually grown some, I believe they did some tomatoes, and they did some other things, maybe some cilantro. And then they ended up harvesting some of those things and actually putting together some salsa that they all got to come and enjoy together. That was done back a couple of years ago in the spring. Some of the other things, the singing together, I mentioned that's just a really fun opportunity for our kids to be able to sing along with the grands, and they enjoy it. Both populations enjoy it so much, and that's what's so beautiful about bringing the two together, because there's so many things that they can enjoy doing with one another. Also activities and, the other core areas, as you see there. We have special events at the center, and I will tell you, as a public school facility, and just, having to make sure that we are doing our due diligence to the curriculum. We can't participate in everything that the skilled nursing center provides. They have a lot more activities, but they do have certain times when we take advantage of those celebrations, and we do interact, and we engage, and the fall festival and holiday celebrations are definitely two that we engage in each year. And we really just try to look to see if it can benefit both. If it's part of our curriculum, we absolutely jump on it. But, we have a few of those extra things built in, but we definitely have to, have our own structure with the pacing guides and the things that we have to accomplish as a public school. And then at the end of the year, every year we have a celebration of learning that's just fantastic. And that's where we bring all of the grands and even those that don't maybe necessarily interact on a daily basis with the kids, we bring them all in. And that's been a fun thing to plan, a fun thing to celebrate, and a real great way to just be able to get everybody involved. The students perform, they sing a couple of songs, and as a group do some fun things, and then we celebrate each of them and their accomplishments at Grace. You can go ahead and go to the next slide, please. And this is a little bit after the fact, but when I talk about our curriculum and I talk about our units of study, they're all built around just starting in the center with that very it's a concentric circle kind of approach, but starting with all about me. Our students are very egocentric, as you might imagine, when working with 4 and 5 year olds. So we start with all about me, and then we build out into understanding more about our community. And then finally, toward the end of the school year, we look at more like the natural world. And so that's kind of how the curriculum is structured. You can continue. And this is just an example of the planning. When I talked about we all gather together and this is what we do, this is just, I just pulled 1 week of planning. And so I could share many more, and always be happy to share with anyone that might be interested. But this is the structure that we use. And you see at the top that concentric circle, they're working on family, inquiry into family and family traditions. And so the big idea, the essential idea, the generalization that we want all of our students to walk away with after that unit is my family demonstrates uniqueness in many ways. And then we're exploring topics, and we have those are already identified. People in my family traditions, places, and family traditions for special times. And then you can see down in the bottom, you can take, well, I skipped the key concepts. We're trying to reinforce responsibility, perspective, and function. Those are common threads throughout the month of that study. And so as you go down and you look at the list, you can kind of see, what those daily experiences look like. We're welcoming our students, and that's how we're bringing the grands in. We're doing the book buddies, we're doing exercise, we're singing together. And you can just see. And then I think like the shared study in this particular situation, they were drawing family pictures with crayons, and that's an activity where the grands come in and participate as well. So they did some Veterans Day kinds of experiences, it looks like, in this particular one as well. And this must have been around this time of year, I'm thinking. I'm happy to answer any questions, but we'll continue on, I guess, to the next slide. So I thought it might be just fun today, and I hope this is okay. I hope I'm not taking too many liberties, but I've talked a lot about what we do, and what we do has changed so dramatically in the past 2 years. Because of the pandemic. So we focused a little bit more on what we do in a normal year. And we're definitely we're not back to normal yet. But last year, all of our students, we were back at the elementary site. We were not in the facility because of COVID. This year we're back in the facility, but we have a little bit of a limited ability to interact, I would say. The students are pretty much right now behind glass, and the interactions are a little bit through the glass, which is not ideal. Book buddies are not side by side with the residents. Right now, they are more like it's a Zoom call or a Google Meet call, I should say. And the students we're trying to engage back and forth. And I'll just be honest, it's very challenging still. So we're still trying to see if we can overcome some of the barriers that are, linked statewide to them being able to interact again in a more normal way. But those are our current challenges. But I thought this would be a fun thing for you to be able to see.
We only have a couple of minutes.
Okay. Can you hit the play on that part? It's very short.
Okay.
Oh, the sound isn't there, but they're singing Your Grand Old Flag, but you can get a feel for what I'm describing right now. And this is, again, a little bit less than ideal, but you can kind of see where we've been. And this is what our interaction currently looks like. And we hope that we're able to do more in person as time goes on. So I'm happy to answer any questions. Thank you.
Great. Thank you so much, Suzanne. You're doing great things there, and it has been challenging, but I love how you're integrating the curriculum and the intergenerational work and being so intentional about it. And I think it's great with a lot of just having you as an educator beyond the staff and coming from that perspective is really helpful. I think we maybe have time for maybe one question, or because I know Sherry has a couple of things that she wants to say. So is there any, and someone asked you to put your contact information in the chat, Suzanne. So I think there may be people that want to follow up with you to get more information. But is there like a burning question or comment someone would like to make before we
Nancy, Sandra had her hand up. So
okay, Sandra. I know Sandra put a lot of things in the chat.
Yeah, so I don't know if it was all responded in the chat or not.
I think she had to go off actually.
Okay.
So anybody else who, Sandra, you're there. You're still there. Maybe she's not.
Yeah.
I see her hand. Anybody else? And this is an unusual model again, because it's not only early childhood, but it's kindergartners.
Judith has a question.
Okay, Danica.
No, Judith has a question. Her
Judith.
hand is up.
Oh, okay.
I love what you're doing. I think it's fantastic. It's identify very closely with the challenges and the way that you put it together, and also with the way that actually the planning integrates what is developmentally and cognitively appropriate and needed for the children, so that you're actually giving them what they need, but it's also therapeutic. Valuable for and emotionally valuable for the residents in the home. I mean, we don't say grams. I'm learning to say gram friends. I'm learning from you. My question is really, with your liaison officer, it's fantastic doing that, but how does the liaison officer involve the care staff? Because in the home where we are based, the average age of entry to the home is 92. So there are some residents who actually have to have a one-to-one. They all need support. And I watched the picture of the, in Shannon's presentation of the teacher kind of leaning against the wall. Well, the number of the care staff who see this as an opportunity finally to kind of relax and shut their eyes is quite interesting. And I just wondered how you actually get their input and their involvement. Thank you.
So if I'm understanding the question, I want to be sure I'm understanding your specific question, but are you wondering how the liaison is able to support the...
How does she use the knowledge of the care staff who actually know the residents even better than her? How are they integrated in? Because we've seen from you how the nursery staff are all involved, and I just wondered whether there's another side to it.
Judith, I think I understand your question now. So and I'm glad you brought that up, because we've had further discussions about that, because oftentimes, she can be the cheerleader and she can be the encourager, but she works very closely with the nursing staff to be sure that, we are finding appropriate entry points for them. And, while some of our grands are able to come and their job may be just to come greet the students in the morning and wave, or maybe just sit passively and watch. Some will want to wheel up and watch the children while they play on the playground. They have a beautiful area where they can see out a window and they can just sit and watch. So there are so many different entry points based on the needs, but we really rely on that communication between the liaison and the nursing staff to help support that and to draw in. She's masterful at going and saying, okay, let's try to get this person, this resident, this grand to come in for shared study. I think this could be a good fit. And so they do lots of communication to make that happen.
Thank you, Suzanne. I hope that answers your question, Judith. And I just want to say, again, I feel like a marketer, but there are some examples of different staffing models in the toolkit. So some people have a liaison, many people don't. So sometimes it's a team, sometimes it's one person from early childhood and one person from the care staff. So I think looking at all those things, also, Suzanne, your job description is listed there. And you can click onto it in the staffing chapter. And I think there's a listing of a curriculum in the activities chapter. So we love all the things that Suzanne is doing, so we've included it. But thanks, Shannon, and thanks to Suzanne and all of you for doing this. And I'm going to turn it over. To Sherry for just a few announcements quickly, because we're almost at 1:30. Thank you.
So one thing that we wanted to reach out and just get folks' interest in is that because of the timing of these calls, it's impossible to find a time that works for everyone around the world. And we'd really like to engage the folks that are doing work in Asia and Australia. So I just know if there's interest from people to do that, thinking of maybe doing a special session. It would most likely be, for it to work for them, it would need to be a time that would be like evening in the US. In Europe, it would be in the middle of the night, and then morning in Asia, which we would again record this and share this with folks, because we don't expect people to, some people might be night owls and are like, yeah, I'm up at 11 o'clock, I join a call, but we just want to get again, yeah, thumbs up or anything in chat if that's something folks are interested in. We'd start to work on pulling a presentation together for some of our network members and partners that are in Singapore, Japan, Australia, that would be able to share what they're doing. Again, I know that Jody emailed me some job descriptions during the call. So if other folks have examples of job descriptions or language that they're using, please help, share. I'll make sure that we get those in the toolkit or share those out to you. Also, we'll be sharing the recording today, continuing to build our resource list. I'll have Shannon's links, those links that we shared, as well as other resources that we know. It's something that we're kind of throwing together, but we'll keep trying to pull those and share those with folks so you can have access to those. So we'll probably be looking at our next meeting, sort of kind of this regular time meeting in January, and then looking to schedule a special event featuring the some of the shared sites and sort of kind of the far side of the world from all of us soon. Again, share any feedback you have or how we can make this as useful and an engaging time as possible. And we'll have more information soon. Again, thank you, Suzanne and Shannon. Thank you all for joining. And we'll save chat and we'll get any some of these questions and resources out to everyone.
And happy Thanksgiving to everyone, at least here. And we hope you have a good month or two, and actually holidays. We probably won't talk to you until after the holidays. So thank you all, and any ideas you have for other topics for other meetings, please let us know. Great.
Thank you.
Thank you.
Bye-bye.
Bye-bye.
Thank you. Bye.